Yeah. On the next slide, before in the next slide, I will introduce the speaker. It is my pleasure to introduce our speakers, Amina Suleiman Rajah. Amina Suleiman Rajah is a dedicated and passionate professional in the field of nursing, midwifery, and healthcare, with a strong commitment to improving healthcare outcomes. And she has made significant strides in nursing and midwifery education, research, and clinical practice. And she has actively contributed to the field through extensive research, earning recognition such as the ACEPHAP Entrepreneurship Award for her innovative work on reusable menstrual healthcare product. Oh wow, it's nice. And the second speaker is Halima Musa Abdul. She is a nurse midwife, a fellow of the West African College of Nursing, and a lecturer from the Department of Nursing Science, Ahmadu Bello University, Zaria, Kaduna State, Nigeria. Okay. And Halima won an international studentship in 2016 to undertake a PhD study of the well-being of the Nigerian midwifery workforce at the School of Healthcare Science, Cardiff University, United Kingdom, and she was awarded a PhD midwifery in August 2021. Wow, it's really nice. Okay, and today they will present a study on nursing students' experience of competency-based education. And okay, we can talk discussion with Halima and Amina. Okay, maybe we can say Halima and Amina. Hi, are you in the room? Halima,
Hi,
Amina.
Bella. Thank you
Um,
for
yep.
that
Okay,
excellent
the floor is yours,
introduction.
Halima.
Thank you, Fabella, for that brilliant presentation and for having me. Yeah, I'm going to walk us through. The topic is supposed to be midwifery students' experiences of competency-based education, a comparative case study of high-fidelity simulation and traditional laboratories demonstration by me, myself, and Amina Suleiman Rajah. So Amina may not be able to join us for now. So, but then if there is any network problem gets sorted out, she should be able to come up as soon as possible. Yeah. So next slide, please. Yeah, so you could see this, all this is around telling you that simulation is very excellent in all training. For competency-based education, we need simulations, high fidelity simulation, documented by research that is super important for preparing midwives for high skills and improving their competencies. Yeah, take me to the next slide. Yeah. So this is my outline. I'm going to take you through introduction, the aim and objective of this paper, the methodology and methods, the demographic from the results, the quantitative findings, the qualitative findings, the discussion, conclusion, implications for midwifery education. Next slide. Yeah, so competency-based education focuses on measurable student outcomes and therefore aligns training with expected clinical competencies. Competency-based education is a pedagogical approach that emphasizes learners' demonstration of excellent skills, knowledge, values, and attitude that should be aligned with professional standard as an alternative to, our normal conventional time-based curricula. Next slide. Yeah, so competency-based education emphasizes on clearly identify competency expectation, repeated practice opportunities, and structured assessments and feedback. Yeah, so why is the shift to competency-based education? The focus now is on competency-based education because it is geared towards demonstrating integrated knowledge, skill, and attitude in authentic contexts. Its goal is that it ensures graduates are practice ready, with competency-based education, midwives, graduates are competent, can fit into any environment they find themselves for complex, high-stake environments. For example, environment that have challenges around maternal and child health emergency. With competency-based education, after training, midwives will be able to fit and give their skill in anywhere they find themselves. Next slide. Now, talking about the dilemma around instruction. Why do we need to go around this bit? Traditional lab demonstration, what happens here is effective for foundational psychomotor skills. That is the muscle memory. But in high-fidelity simulation, it is totally immersive. There's realistic scenarios that will help students navigate issues within their environment before going to the clinical area. It is very important for targeting clinical judgment and also for communication. Yeah, so high-fidelity simulation is, in particular, provides realistic and immersive clinical scenario that allows students to totally engage. They engage with complex patient case situations, which can enhance competencies and competency acquisition. That is why it's super important. Then what is the research gap around this area? There's limited qualitative evidence that exists comparing how students experience competency development across these two distinct modalities within a formal CBE framework. Either the conventional, which is the formal that we know about, which is the traditional, and then using the high-fidelity simulation. Give me the next slide. Now, the aim of this paper is to explore midwifery students' experiences of competency-based education across two instructional approaches among the fourth-year students at Bayero University Kano. We had two groups. We looked at those students that had used the traditional laboratory demonstration and then those that used the high-fidelity simulation. Now, what is the key focus of the study is to look at the perceived competency development, what is the clinical judgment and decision-making, feedback quality and assessment transparency, psychological safety and error management, how are they able to navigate around that, perceived readiness for real clinical practice. Next slide. Give me the next slide. Methodology. Now, the design is a qualitative dominant comparative case study. Setting is the Bayero University ACEPHAP Simulation Lab. The participants are 28 fourth-year students, the maternal and child health course. So these students are nursing students. At the 400 level, they are supposed to cover their modules of maternal and child health nursing. And so those are the students that we use for this study. Now, the data collection is a semi-structured interview qualitative. Performance observation rubrics were used for quantitative, which is 1 to 5 scale. Next slide. Now, the methodology, we have two cohorts. We have the cohort 1, the lab demo, which means they were exposed to using the lab demo, which is the conventional method. Step-by-step checklist was used. And then the mannequin-based task training was also used. The instruction-led corrective feedback was used, and the focus was on the procedural accuracy. Then for the cohort, very importantly, immersive scenarios was used. Then there was structural debriefing was using the GAS model. Then there was more focus on integrated performance and teamwork. Give me the next slide. Then this is the result. Now the result, the social demographic characteristics I've mentioned we had 28 students divided into two groups, 14 and 14 in the high fidelity simulation group. Age 23 to 27 is their age, and the females, we have 71.4% in the traditional method, of gaining the laboratory skills. And then the high fidelity simulation, we had 64.3% were female. The cohorts were comparable in age and gender distribution. Students were in their final year, having completed their prerequisite didactic teaching on maternal and child health competencies. Next slide. Results. Still on it, the main competency rubric, you can see then, and then the main domain was communication, the clinical judgment, we looked at assessment, we looked at the technical skills, we look at overall competencies, and we could see the main for the lab. And then we have the main also for the high fidelity simulation, and we all have the effect size using the Cohen's D 1.4.5. We could see we have large to moderate effect sizes. Yeah. Next slide. Now, the qualitative finding. Now, because we use case study methodology, sometimes it allows you to have a bit of quantitative bit into it. The 6 emergent themes describing the contrasting learning mechanism. We have 6. We have the structured competency and clarity. We have judgment and readiness. We have the environment, pseudo-realistic versus controlled, simplified. We have feedback, step-focused correction versus reflective debriefing. We have psychological safety, error as failure versus error as learning opportunity. Then we have practice readiness. The other one is task preparedness versus holistic world readiness. Next bit. Now, the qualitative insight. Now, from the lab demonstration, we could see from team 1 and 2, you could see the data extracts presented here. And the first cohort, the participants said, we had a checklist. Doing it correctly means following step in order. In the high fidelity simulation, it's the participant, one of the participants said, competency is not list the step. It is the ability to recognize the problem, prioritize action, and communicate. And then the other, in the lab demonstration, we also have, I know the how, I'm less sure about when and why. And then in the cohort, in the high fidelity simulation, they talked about the scenario was messy, like real life. You have to think on your feet. That means it may make real life environment based on their experiences. Then the focus here was on muscle memory and procedural sequencing. While in the high fidelity simulation, the focus was on clinical reasoning under pressure. Next slide. Team 4 and 5, we have under the lab demonstration, we have feedback. You forgot to check the box. Then under high fidelity simulation, we have debriefing was transformative. What were you thinking during this is what one of the participants said. In fact, it was typical among many of the participants. Then the next slide, the next talked about under the lab demonstration, missing a step meant a loss of marks. Then in simulation, we love mistakes because that is how we learn. This is from what the participants are saying. Focus now in the lab demonstrations, the participant talked about correction action on steps, while in focus, 360-degree reflection on reasoning. These are data extract from what the participant said. The next slide as well. Now, point of integration is very important. You integrate this into domain communication. There's a large effect with D equals to 1.45. Then the qualitative explanation, the why. One of the participants said, one learner, one instructor, no pressure. That is under the lab. Then the high fidelity simulation, the family member is asking questions while I'm managing emergency. That is what one of the participants said. Then around clinical judgment, of course, there was a large effect of 1.23. Then under the qualitative explanation, the lab, I know the step, but what if the step don't work? Then in the high fidelity simulation bits of participants, one of them said patient deteriorated based on my decision, and it was unforgettable lesson. Then in technical skill, we have a moderate effect of D equals to 0.66. Now, both cohorts said you built muscle memory. Then the high fidelity simulation cohort, but in simulation, I did the skill while also managing chaos. Yeah, so give me the next slide. So this is all about mixing and bringing in the two data together. Next slide. Now, implication for midwifery education. Foundational role of lab. Traditional lab demonstration is essential for initial psychomotor skill acquisition. Of course, trust me, we can't throw away the skills and what we get from the traditional lab demonstration, which is very important around muscle building, muscle memory. Value of simulation. High fidelity simulation is superior for developing integrated competence. I'm sure many global midwifery framework have talked about I've also talked about how very important competency-based education is. It has talked about, it has, like the World Health Organization 2019 emphasized the importance of adequately resourced midwifery education programs that offer high-quality learning experience and are competency-based. This is from the World Health Organization 2019, and even the ICM 2021 competency standards. I've talked about the importance of integrating simulation into practice, especially the high fidelity simulation. It is superior for developing integrated competence, clinical judgment, and communication, which are the core tenets of competency-based education. Now, the next is debriefing difference. Structured debriefing, that is the GAS model, transforms errors from academic penalties into powerful learning moments. This is very important for the midwifery education. Give me next slide as well. Then the sequencing strategy. Step 1, use lab demo for technical proficiency because of its low stake and its high repetition. That is one of the importance of the lab demo. Step 2, use the high fidelity simulation for contextualization and application of those skills in complex scenarios, of course, in high realism, safe. Of course, you have safe failure. That means you'll be able to navigate again, build your confidence before you step into the real world in the clinical setting. Next slide. Now, the limitation of this study, the setting is just a single institution, and the students were already were running their midwifery courses. Of course, we had to wait for them to exhaust their midwifery courses before we expose them to the training. Sample is a non-randomized cohort allocation, and the grouping was a bit pragmatic. Then baseline, prior competency equivalence between cohort was not formally established. That is one of the limitations. Yes. Yeah. The next slide. Now, this is recommendation for future research direction. This is for students who wants to expand the study, multi-site trial, larger randomized control studies will be very, very useful and very important for this study in the near future. Longitudinal impact. Does simulation training lead to better patient outcomes or skill retention in the actual clinical world? This is a big question which can be proven by a longitudinal research. Then resource optimization, identifying the ideal blend-stroke ratio of lab versus high fidelity simulation, especially in low resource setting. This is very important and very important for our future research. Next slide. Now, in conclusion, laboratory demonstration provides the foundation. Trust me, the technical know-how, take it or leave it. High fidelity simulation build the clinical house, the judgment, communication, and total readiness, because students are able to mimic an environment that looks similar to the environment they have. They will navigate, build on their confidence, have repeated failure, and then perfect their skill before going to the clinical areas. Next, to fully realize the goals of competency-based education, nursing curricula and midwifery curricula must move beyond checklist assessment and intentionally integrate high-fidelity simulation. Trust me, high-fidelity simulation allows students to transition from performing tasks to thinking like a proper midwife in a safe, reflective environment. Next slide. Thank you very much for your total attention. Thank you all. So this brings us to the end of this presentation. And here are my references. This is our references. Thank you all.
Okay. Thank you very much for that insightful presentation, Halima and Amina. Okay. And we will now move to the Q&A session for the all audience. You may raise hand if you like to speak, or you can drop your question in the chat Zoom. And please introduce yourself briefly before your question. Okay, anyone?
Let me change the settings here so that people can speak instead of chatting. You can, okay, they already can unmute themselves. So, right, if people would prefer to ask their questions by just raising their hand and Fabella can recognize you and then just go ahead and speak. No need for chat.
Yeah.
Brilliant. Somebody thought it was brilliant. Yes.
Nice.
I would like to say it's interesting. Celine and I were talking in the chat that what about low resource settings?
Yeah,
And
sorry.
are people familiar with Mama Natalie and Neo Natalie? It's a simulation that is, the mother and the baby and a basic resuscitation all set up in a backpack. Amina, you're familiar with it? It's all set up in a backpack, and the a real person will wear the uterus and push the baby out. But it's great for teaching basic OB skills, emergencies, neonatal resuscitation. And you don't need a lot of high fidelity simulation. You can just take it with you to wherever you need to go.
Yeah. And we have the question in chat box. Sorry, I'll check. And Amina is raised hand. Maybe Amina, please, I click ask to unmute. Can you click? Yeah, okay. Yes, Amina.
Okay,
Please.
thank you very much, Prof. Halima, for that wonderful presentation. It's really timely. I just need a clarification in respect to the methodology because it's like she mentioned qualitative study, but along the line, I can see her bringing in quantitative. So I'm a bit confused. Please, if you can clarify that for us, it would be good. Thank you.
Yeah, thank you very much. So case study is an aspect of a qualitative design that has a bit of quantitative component embedded in it. Yeah. So what we try to do, if you look at what we call the case study, we call it a case study dominant. So the qualitative component of the case study is about 90% more than the quality when you look at the overall study overall. Yeah. So that is why if you look at the name of the qualitative, it is called a qualitative case study, qualitative dominant research. That was what it was called. So it allows you to integrate a bit of component of quantity, and that is what we did in this study. I don't know whether that has answered your question.
Of
And then
course,
you see at the
point
of mixing, at the point of, you saw where we did the mix of the integration, the mixing of the integration. Yeah. Yeah. I hope that is clear.
Very clear. Thank you very much, ma'am. Thank you.
Right.
Okay, thank you, Halima and Amina. Okay, hi, I said to Musa. Okay. Maybe can you speak right now, please?
Okay, thank you for the presentation. It's a very interesting topic. But I was wondering, I need some clarification, please. The simulation that was done, was there a peculiar procedure, or it was left open? One, and the cohort, how was the cohort constituted? Thank you.
Yeah. Yeah. So from what we talked about, we looked at postpartum hemorrhage, we looked at neonatal resuscitation, and we look at, I think we looked around 3 of them. It was all midwifery embedded one. So how they were selected, that we told you that the selection was just done randomly, and they were selected into two groups, 14 students. These ones went through the traditional bits, and the other 14 cohorts went through used the high fidelity. In fact, they were part of the training. Then how were we able to get those documents, all the simulators we use? So at some particular time, we had a training in collaboration with a university in the US that came to Bayero University, and at the Center of Excellence, with loads of simulation, and then train some of us. So some of us, the authors, were trained during that time. And at that point, we were able to select for 14 students that were part of that training. So it was those students that we used for this study. And other 14 students were used who are already exposed to the traditional but didn't participate in the high fidelity simulation training. So that was what we did. And that was why we gave a further recommendation that if this could be randomized better, it will improve the quality of future studies. Yeah, I don't know whether that has answered your question.
Yes, thank you very much. Very clear now.
Thank you.
Okay, thank you for your question and answer. Okay, the next is Margaret. Okay, hi. Okay, can you speak right now? Yep, Margaret.
Can you hear me now?
Yes,
Hello?
I can hear you.
Okay. All right. Good day, everyone. Thank you to Professor Halima for that interesting presentation. I'm looking at competency-based midwifery education. We all will agree that that's the way to go. But when you talk about competency-based education with the use of high-fidelity mannequins, you talk about less low resource countries, and like people in West Africa, sub-Saharan, a low resource setting. You talk about use of mannequins. I recall last when I attended the ICN in Bali, we were talking about use of Mama Bati, and it was kind of recommended for institutions. But I'm aware that in some low resource settings, schools, institutions, midwifery institutions are not able to even have these mannequins. So I don't know if you built into your study or there are recommendations around how to improve access to high fidelity mannequins. You know, if we are actually recommending the use of these mannequins in advancing competency-based education. Don't know if you have your thoughts around that or made recommendations in your research.
Yeah,
Thank
so
you.
thank you very much, Margaret Easy, for asking this very brilliant question. Yeah, so I know I'm part of an ongoing research that the Nursing and Midwifery Council are partnering with many organizations to see how they can support about 19 to 20 midwifery institutions with simulations. And then they've done that, and I know they've done that in the last 1 month. Yeah, so that is helping us to see, that is demonstrating how very important they know, and research has proven that CBE is the way forward based on global midwifery framework. And yeah, so in low resource setting, what we can do to help us with that is partnering with organizations. I remember recently I made a presentation where someone from UNFPA was there. I was talking about the ICM recommendation for CBE, and I talked about simulator. He was very impressed and asked that, what can we do to support? So putting up papers, partnering with donor organization, spelling out, writing a compelling proposal for people to support us, to fund us with high simulators. Now, if even this research we did was we just took an opportunity to see how we can grab and explore students' experiences based on the training we had at the time these simulators was provided in Bayero University Kano. So I could say what council are doing now is very important. That would stimulate the further use of fidelity, high HFS. And then, yeah, I know mannequins are super expensive, but change is changing. Things can happen when we collaborate, and well, who knows, things can be able to get turned around. And then when we keep pushing and knocking on doors, of course, we're going to get more opportunities and see how we can do that, even in low resource settings. Yeah, thank you.